Being micturition, frequent urination. But is it really an infection? Urine culture gives the real answer. Urine culture is one of the most commonly requested tests in microbiology labs to detect the urinary tract infections and guide the correct antibiotic therapy. I'm Sneha, and in this video, let's understand how urine culture is done, which media is used, how to streak, and how antibiotic sensitivity helps clinicians choose the correct drug. At the foremost, let's see what is urine culture. Urine culture is a quantitative culture technique used to isolate the bacterial pathogens from urine, determine the significant bacteriuria, and perform antibiotic sensitivity testing. Not all bacteria in urine means infection. Let's see what are the sample types preferred for urine culture. The midstream clear catch urine, the catheter urine, and the suprapubic aspirate, which are preferred in rare cases. The proper collection is critical to avoid contamination. Moving forward to the medias used in urine culture. The first type of media is cled agar, cysteine lactose electrolyte deficient agar. This media helps in preventing the swarming of proteus. In this media, the lactose fermenter are seen in yellow colonies. The non-lactose fermenter are visible in blue or green colonies. The next type of media is McConkey agar, which helps in differentiating lactose fermenters and the non-lactose fermenters, and are also helpful for gram-negative bacilli identification. The third type of media is optional, the blood agar. It supports the fastidious organism and also shows hemolysis. Cled is the primary and most preferred medium for the urine culture. Loop size is essential for colony count calculation. Let's check the loop size used for urine culture. The calibrated inoculating loop having 0.001 ml or 1 ml is most commonly used. Sometimes used in specific labs like 0.01 ml or 10 ml loop. Let's go through the streaking method in urine culture. The streaking method in urine culture is semi-quantitative streaking method. Dip the calibrated loop vertically into well-mixed urine. Touch the loop area in the center of the plate. Streak in a straight line. Spread at right angles covering the entire plate. The next process is incubation. Incubate the plates at a temperature of 35 to 37 degrees Celsius for 18 to 24 hours. After incubation, the plates are examined for colony count, colony morphology, and the lactose fermentation. During examination, if the organisms have a colony count greater than or equal to 10 raised to 5 CFU per ml, they are categorized as significant bacteriuria. If the organisms are 10 raised to 4 CFU per ml, this is suspicious case. Always correlate clinically before reporting. If the organisms are less than 10 raised to 3 CFU per ml, this is contamination. Always correlate the report with clinical symptoms. Now take a look at this Cledaga plate. These creamy, smooth, whitish colonies you see here are not bacteria. This is yeast growth, most commonly the Candida species. The interpretation process is followed by antibiotic sensitivity testing, done using Kirby-Bauer disc diffusion method, performed on Muller-Hinton agar. Now let's look at the commonly used antibiotics for urine culture. For gram-negative organisms, we commonly use ampicillin, amoxicillin clavulinate, cefepime, piperacillin tazobactam, gentamicin, amikacin, and nitrofurantoin. The ampicillin, penicillin, linezolid, teicoplanin, vancomycin, and the ciprofloxacin comes under gram-positive organisms. The nitrofurantoin is one of the most preferred oral drugs for uncomplicated urinary tract infections. Let me discuss about the common organisms isolated in urine culture. E. coli, Klebsiella species, Proteus species, Pseudomonas aeruginosa, Enterococcus species, and Staphylococcus saprophyticus. The final step is reporting. The final report includes the organism isolated, the colony count, and the antibiotic sensitivity pattern. Finally, let's discuss about the common errors to avoid while performing urine culture. Using the uncalibrated loop, improper streaking, delayed processing of sample, and the reporting the contaminants are the most common errors which are found in urine culture. Urine culture is not just growing bacteria, it's about getting the right treatment at the right time. Accurate sample collection, proper media selection, correct loop size, and standardized sensitivity testing are the backbone of reliable urine culture results. A small drop of urine can make a big differences in patient care. And that's all, buddies. Thank you for your valuable time. Stay safe and curious. We'll meet you all in my next microbiology facts only on Medical Guruji. Thank you and bye bye.